Okay, so we are going to be talking to you guys about narrative therapy. As all of you know by now, narrative therapy is a theoretical theory, which is a theoretical stance. So, what that pretty much means is uh, narrative therapy is mostly about like structure of therapy and a few belief systems around where problems come from. Um, and in the case of narrative therapy, the idea is that problems actually get generated when a person has like a problem saturated story in their head about something that usually comes from societal influences, sociocultural practices, assumptions or expectations from either like a large societal level or a local level, like at their closer relationships, like their immediate family or friends or partners. So what we're going to be doing is walking you guys through the kind of overview of what a narrative therapy treatment might look like. And it's actually pretty defined in terms of stages, even though you don't always go through them so smoothly. But there are stages of therapy in narrative. So Kendra's going to explain those a little bit.
So the first part of narrative therapy, and it's probably the most important part from this perspective, is meeting the person. And it's really meeting the person where they're at. And it's to really separate someone from their problem, you have to get to know who they are. So this first phase is about identifying their hobbies, their values, their everyday aspects of their lives. And that includes their education, their job, who's involved in their life and who's not involved in their life as well. And then the second phase is really about listening. It's listening for the effects of the dominant discourses and identifying times without the problems. It's looking for those unique outcomes, so to speak, and helping the person identify that. And it's then leading into separating the person more clearly from their problem. It's externalizing and separating in a way that gets them to feel able to create a new identity and a new life story is allowed to emerge. And then it's going to enact preferred narratives and identifying new ways to relate to that problem and reducing the negative effects on the lives of all involved. And then finally, the final phase would be solidifying, which is strengthening the preferred story that you've come together collaboratively to create and and the new stories, the new identities, and is having the client witness them themselves, and then having the significant others in the person's life identify those as well.
Okay, so meeting the client is super significant and important, and by and far the first step of narrative therapy. Um, Narrative therapy is a large part about separating people from their problems. So, in order to see a person as a person and as capable and having their own strengths and protective factors and all that stuff, you really need to start out therapy by learning all these things and getting a lay of the land, if you will. So, what we did here is we kind of just have a wonderful drawing Kendra did of our client. His name is George Johnson. Uh, George Johnson's coming into therapy because he has the presenting problem of he's struggling to find meaning in life, and he's a stay-at-home dad. And as a narrative therapist, our goal isn't just to take into consideration that and fix that problem, but it's more about um, okay, so this is what this person's coming in as and saying that their issue is. Let's look at what their general protective factors are, which is pretty much like their spiritual beliefs, if they have any, hobbies, what are their interpersonal relationships, what are their values, what's their education like, what's their interests, what are their general strengths, what does their family look like, what cultural background do they have, and how does that influence them? What is their job and economic status? And then that's really the first step to really get a whole picture of who they are and how they are, so you can know not just what their problem is, but also how that problem impacts the person.
So for this next part, we want to show what it would kind of look like to do narrative therapy. And during this part of the session, I've already met George. I know him separate from his problems, And so right now I'm going to be focusing on really meeting the problem and mapping its influences. So when did this all start?
I guess I've always kind of felt worthless ever since I started being a stay-at-home dad, but it was
Okay.
never really that significant until maybe about 3 years ago.
Okay. What kind of things happen when you start, when you notice the feeling of worthlessness taking over?
Um, Usually it's something around like I notice my kids don't need me as much anymore, or my partner just did something to make her more successful at work, or like my
Mm-hmm.
friends when I notice like how successful they've been like in their work lives. Like those are usually times where it kind of takes over.
Okay. What effects does the feeling of worthlessness have um, in your life and in your relationships?
Um, Feeling worthless really impacts the way I take care of myself.
Okay.
And I don't do things as consistently as I should. Um, Eating healthy, exercising, being kind to myself, things like that. And then also it impacts the way I parent at times.
Mm-hmm.
I'm not as present as I'd like to be. And I'm not there for the kids in ways that I think I should be. Like I don't always help them with their homework as much as I'd like to, or I don't ask them about their day and get to know them as much as I'd like to, because I'm kind of stuck in feeling worthless.
Okay. Now, have there been times when you were able to keep the feeling of worthlessness from taking over?
Yep. Um, there's times where I feel that way, and I try to remind myself of certain things, like it's okay that my kids are becoming more independent. That's a good thing.
Mm-hmm.
Um, I When my partner compliments me on like the work that I do at home, as opposed to just not really seeing it as like contributing, and when um, I'm able to remind myself of what my role in the family allows us to do in terms of parenting.
Okay.
So we just looked at our client George Johnson, and we did a little bit of introducing ourselves to the problem. And for him, it's about feeling worthless and like he doesn't have as much meaning in his life. Stay-at-home parent, all those things. Um, a really important part of when you start to introduce or familiar yourself to the problem is about the externalization process, which kind of was starting to do.
Mm-hmm.
Questions like, when did this, when did you start to have this happen to you? When did you start to become familiar with this problem? Or, and then it kind of carries on into, how does this problem affect you, and how does this problem affect your relationships, and how does this affect you on physical, emotional, all those levels.
Mm-hmm.
And also, this type of externalization will also lead into things like trying to find unique outcomes and start to deconstruct this narrative a little bit. Like, have there ever been, if we were talking about George, it would
Yep.
be about. Have there ever been times when you got the best of feeling worthless? Or have there ever been times where you felt worthless and it didn't impact the way you parent and things like that? Those are all things that really help reinforce that that problem of feeling worthless or not important isn't something to be externalized, and it's not about you. It's something separate from you
Mm-hmm.
that's impacting you right now. And uh, what it looks a little bit like is this. This is about stories after all, and this is a terrible drawing, but you can see it's kind of like a story is like a pie, and over on one side we have like a problem saturated piece of pie. That's usually what people focus on or can see for themselves. And what we're going to try to do is expand that story so they can see the whole pie or at least more pieces of it, which are what we would call like unique outcomes. That also is similar to some of the strategies in solution focused. It helps people see that there's more than what they're currently seeing right now. So, and our job really isn't to tell them, like, here's how you should think about this problem.
Yeah, it's all co-authoring. It's a co-group. When we're doing narrative therapy, it's, the therapist is the expert, but it's important for the therapist to, delineate that hierarchy and to show the client that, you're the expert in your life and this is your story, and I'm here to walk with you on that journey. And so it's a very collaborative method.
For sure. Narrative literally has entire things about co-authoring. It's not about, we don't try to necessarily fully like loop in a better story for them. Like we need them to help us, and we need to help them like write a new narrative for themselves. Yeah. Or preferred story is what they call it.
And it's, the therapist has to be mindful over what's the preferred narrative of the client, because we were talking how I would go one way, but that's probably not his preferred narrative. And so it's really identifying, okay, what's their preferred narrative and how can we goal set to get there, because there's different phases in narrative of goal setting.
Yep.
Starting off small and building bigger to get to that preferred.
Yep. And we showed you guys a little clip essentially of starting the process of mapping the problem and its impact. And a part of that has to do with asking, and Kendra did this a little bit, asking, okay, how does this impact you? How does feeling worthless impact you? How does it affect your relationships? And kind of mapping the impact of that problem. And a good next step would be, is that what you want? Is that how you would like things to be? And not assume that, oh, that needs to change. And that's a part of the co-authoring process, is somebody else like actually asking them, is that how you want it to be? If not, okay, let's work on that a little bit. And as we start to find unique outcomes and things like that, it's also important to ask, like, would you like it to be like that more often? Like, let's say George had an incident where, he felt worthless but still fulfilled all of his parenting obligations, where he didn't feel like he impacted his kids. Would you like it to be like that more often? Yes, absolutely. He maybe felt worthless and he managed to overcome that and still, not pull away from his wife or something like that. Like those types of outcomes, is that what you're looking for? And then to kind of start the process of encouraging, which is like scaffolding, which is something that we talked about in class a lot, which is a progressive move into changing the narrative. The low level being just like challenging the way that they think about it and trying to encourage somebody to think about it more in line with the unique outcome, all the way up to the high intensity scaffolding, which is like a complete rewrite essentially. So.
And one of the other parts of solidifying, which is one of the final phases, is getting other people to notice the differences and having, like for George, it'd be having his kids notice, having his wife notice, his friends notice the difference in his narrative and that's just really reaffirming that for George, that he is making progress, and that's just encouraging to help him to keep going up that scaffold, as you're saying.
Yep, and even having those people reinforce the new narrative, like, oh, in spite of that, like, look what you did. Like maybe his partner being more mindful and commenting when he does express a unique outcome situation or something like that. Those types of things are what really help reinforce and keep the narrative going, as opposed to reverting back to an old one. So, good.